have a heel spur that they're suffering with. And it's said that 40 to 45% of people in their life will have some type of chronic bottom of the heel or back of the heel pain. Heel spurs are one of the most common and debilitating things we see. I see a lot of people in pain suffering. So heel spur is defined as 2 millimeters or more growing on the bottom of your heel or the back of your heel. When we take an x-ray, this looks like a spike coming out of the bottom of your heel, which is associated with your plantar fascia, or a big spike on the back associated with your Achilles tendon. So the heel spur without x-ray is not really visible. So you can take your hand through your skin and you can try and push up on it. The area will feel bruised, but you won't really feel the spike. And same thing on the back of your heel. It'll feel bruised, it'll feel sore in most cases, but you shouldn't really feel the spike unless you're like 70, 80 and it's a... So here's the risk factors for heel spur. If you're elderly, if you're stiff, if you have a tight back, tight glutes, tight hamstrings, tight knees, if you have knee pain, hip pain, if you're an athlete and you get up in the morning and the bottom of your foot is sore, the back of your heel is sore, if you feel like you're getting slower and achier and you can't jump as high and you can't run as high, these are things that might signify a heel spur. What a heel spur is, you can think of a rope. When you pull on the rope, that rope gets damaged. Well, the body tries to fix these things. So the ligaments that pull out of your heel, rip out of the heel on the bottom, that's called your plantar fascia. So when your plantar fascia rips out of the bottom of the heel, your body tries to create new bone to strengthen that. That's what the heel spur is. Or in the back of your heel, when your Achilles tendon is vertically pulled, that rips out of the back of your heel with microscopic little tears and damages the area. And what happens is your body, day after day, year after year, grows a spur to strengthen that insertion. So your Achilles tendon coming in the back and your plantar fascia coming in the bottom. That's what leads to the heel spurs. Loss of fat pad. If you're missing fat pad, if you can feel your bones on the bottom of your heel, if you lose fat, you're going to get more pressure on your heel. And it's possible to have a heel stress fracture. So if you take your heel and you actually squeeze it with your fingers and it aches, not just from the bottom, but from side to side, that could be heel stress fractures. The thing is, you have to get an x-ray if you think you might have one. So podiatrists generally specialize in doing this. So in clinic, I would do a physical exam, and a lot of times you could tell ahead of time who's going to have a heel spur based on the treatments that I'm going to tell you ahead of time that can help you without having to see a podiatrist, but I do recommend it. And when we get the x-ray, you can see the spur at the bottom of the heel or at the back of the heel. So 2 millimeters or more is the official definition of a heel spur. And what happens is, if it's at the back of the heel, it's usually a tight Achilles tendon, tight hamstring, tight knee, tight hip, some type of previous injury. Or if it's at the bottom, it's usually associated with plantar fasciitis and the spur forming from tension there, associated with being flat-footed or even high-arched. I'll tell you, I used to do some of these surgeries at the beginning and they worked okay, but everybody hates surgery. Why would you get surgery done when there's easier things to do? You know, I know there's some people out there that think like that, and so be it. You know, if you want your spur removed, we can help with that. Here's how the surgery works. Studies show that basically removing the spur is not what's recommended anymore. There's a procedure called an endoscopic gastrocnemius recession. So lengthening the calf muscle will take pressure off the back of the Achilles tendon and it will take pressure off the bottom of the foot. So I'm a big fan of using topical creams. I hate pills. There's too many pills in America, pain medication. Everybody's familiar with all the problems of taking pain medications and pills. Creams can be good because they don't go into the body, thus you don't get as addicted. But if you do take a pill and you're forced to, stick to ibuprofen, Aleve, you know, the anti-inflammatory pills. Never go more than 2 weeks in my opinion. I'd probably go a lot less than that. But the creams there's anti-inflammatory creams. There's things like Voltaren that are available. But Biofreeze is great. It's cheap. You can roll it on. It's a cream. In like 15-20 minutes, it's like icy hot. It gets your pain level down pretty quickly. Icing's great too. So freezing a water bottle's great. Freezing, you know, just taking an ice pack on the bottom of your foot, massaging back and forth can work really good. And doing massages. Massages on your plantar fascia on the back of the heel, especially with frozen devices, That's the best way to get pain relief. Great shoes, great supportive sandals. So what you want to do is shoes with orthotics. Those two things are amazing. And then a home slipper. What you want to do is think about support, not as immediate pain relief. The immediate pain relief's from the ice, from the massage, from the Biofreeze, from the pills. What shoes and orthotics do is they hold your feet straight. So check out your plantar fascia down here. It inserts from your heel to your foot. And check out your Achilles tendon. It inserts from the heel up to your calf muscle. So pretend on this foot model, this is an expensive foot model. Watch the bottom of your foot when I push down with gravity. See how the bottom stretches and see how the Achilles tendon stretches. So what happens is the foot's fairly straight, but now it buckles out to the side. So that rotation movement stretches the Achilles tendon, and that front to back motion stretches the plantar fascia. So the more weight you push down on your foot, the more the Achilles tendon and the plantar fascia stretch. For my purposes, I can kind of consider them the same unit. More downward pressure collapses that arch and that Achilles tendon. Year after year, that's going to give you plantar fasciitis, Achilles tendonitis, and as a result, spurs on the bottom or the back. It's kind of random which one comes first. Most people get plantar fasciitis. There's a lot of factors, but we have to do everything we can to prevent this foot from flattening out. So what's the best way to prevent your foot from flattening out? Great support and great posture. So check this out. Look at how much that flattens. Check this out on an orthotic. Oh, look, it's not flattening at all. Check the back right here. Look at how much it flattens out to the side. That's Achilles tendonitis. Check this out right here. It's not really flattening. So what happens is orthotics work phenomenal. They prevent that stretch and twist on the Achilles tendon, and they prevent that stretch on the plantar fascia. This alone right here will prevent new damage from happening. Now I'm going to warn you, it can take 1 month to get roughly 40 to 50% better, 2 months to get, 60 to 75% better, and 3 months to get like 75+% better. So wearing an orthotic for 1 day is not going to fix it. It doesn't work like that. That's where the ice massage, staying off of it can help. So same kind of thing. If you're working 16 hours on a factory floor and you're 400 pounds, an orthotic will make it better, but it's not guaranteed to fix it. And this is where people go wrong.
Now, do these heel spur pads work right here? They do provide a little vertical relief, but that's not what's going to stop the plantar fasciitis from stretching. These work for most people because they lift the heel. They will give you some immediate relief, but they won't work long term. That's why I kind of stay away from these. Go with an orthotic. Get a little bit more lift on your orthotic.
What about barefoot walking at home? You're not going to wear an orthotic. Watch this. Flattening. Oh, look at this. A generic supportive insole. And I like my favorites below. Look, it's not collapsing. And look, same thing, slippers with orthotics in there.
These ankle braces are amazing for heavy duty. If you're really heavy and nothing's helping on the inside of your ankle, something like this could help quite a bit. And you can see here, I actually purchased this one a while back. I love braces overall. I test everything out. Are they as strong? So you can check out the different colors. They're not as strong as the one. If you have a hard time putting the other ones on, this could be a good one. But if you need heavy duty support, get the other stronger one with the laces that I showed you.
Massaging is phenomenal too. So massage sticks, massage guns, balls to roll on your feet, frozen ice bottles. These things all work.
Is something like this pretty good? Yeah, absolutely. But in the videos, I kind of use a towel to do the same thing. You can do a lot of different stretches. You can sit in a chair. If you're really having a hard time getting down to your feet, this is not bad. It holds your foot. It helps you get a nice calf stretch and a nice, I'd use it specifically for these, although the thigh is good too. Stretching right there. But if you're having a hard time, a device like this, an ankle slant board, can help you keep track of it. So it starts at 15 degrees and see, can you touch the floor there? I can right there. But now I move up to say 20 degrees. And what happens is for a week or two, I'll do that. And if I feel pretty good, I'll move up to now 30 degrees as an example. I think this goes up to like 45, 50 degrees. But over time, you can keep track of your flexibility, get your calf muscles, your hamstrings flexible. And that's the trick.